Hello, my name is Angharad Wooldridge. I'm a senior public health practitioner and I work for the Primary Care Division in Public Health Wales. I'm joined today by my colleague Sian Evans, who will be presenting the second half of this presentation. We're here today to talk to you about the impact of healthcare and therapeutics on the environment, and specifically what you can do about it by joining and supporting the Greener Primary Care Wales Framework and Award Scheme. So what is the relationship between healthcare and the environment and healthcare? We know that healthcare contributes significantly to carbon emissions and therefore climate change. Globally, it is equivalent to 4.4% of emissions, and in Wales, the NHS carbon footprint was calculated as approximately 1 million tonnes of CO2 equivalent in 2018-2019, which represents about 2.6% of Wales's total greenhouse gas emissions. On the flip side of the coin, climate change is the single biggest threat to human health and well-being, and will have both direct and indirect impacts on your patients and communities. Some of these impacts are related to poor air quality, leading to more frequent exacerbations of respiratory conditions, extreme weather events such as storms and flooding disrupting access to healthcare services, a changing pattern of emerging infectious diseases, and climate anxiety. It is therefore no surprise that a recent report from Public Health Wales stated, "Climate change will have a major long-term impact on health, well-being and equity. These impacts are multifaceted and not static and will affect the population of Wales in the immediate and long term." Unfortunately, unless we change what we're doing, this negative cycle of climate-related ill health leading to increased use of services and therapeutics, therefore producing more carbon emissions and worsening the impact of climate change, will continue to perpetuate. In Wales, the Senedd was the first parliament in the world to declare a climate emergency in 2019. And previous to this, the Environment Wales Act 2016 placed the duty on Welsh ministers to set targets for reducing greenhouse gas emissions. Our goal in Wales is to be net zero emissions by 2050 across all sectors, including the private sector. And in the not so distant future, the ambition is for the public sector and therefore the NHS to be net zero by 2030, just over 4 years away. You may be familiar with the NHS Wales Decarbonisation Strategic Delivery Plan, which is the roadmap for the NHS to decarbonise by 2030. It contains over 40 initiatives, some of which relating specifically to medicines such as inhalers. This plan is currently being reviewed and we expect the updated version to be published by the end of the year. Hopefully I've been able to highlight why climate change matters to you as healthcare professionals, the impact it can have on your patients, and what the Welsh Government is aiming for us to achieve in terms of carbon neutrality in the NHS. However, what can you actually do about it on the ground as frontline professionals? That's where the Greener Primary Care Wales Framework and Award Scheme comes in, which hopefully some of you may have heard about and may already be a part of. Our team in Public Health Wales launched the scheme in 2022, and it's designed to be a simple, practical tool to help all primary care settings become more environmentally sustainable in their day-to-day practice. It's an online framework which contains over 50 different climate-friendly actions across a range of categories like procurement, waste, adaptation, healthy behaviours and more. For each action you complete on the framework, you achieve 1 point, and as the points build up, so does the level of award. We've partnered with a charity called SOS UK who help us run the scheme and conduct the virtual audits at the end of each cycle. All of this is endorsed by an expert group consisting of Welsh Government officials, professional bodies and frontline clinicians. Here on the screen you can see a screenshot of a new interactive map we've recently published on our website, which showcases all of the practices across Wales that are participating in the scheme. Our website also contains many other useful resources such as case studies, videos and FAQ documents. Before I hand you over to Sian for the second half of the presentation, I'd like to play you this short animation which summarises the scheme and will hopefully encourage you to join. Diolch yn fawr.
The Greener Primary Care Wales Framework and Award Scheme was designed to help primary care reduce its environmental impact. In 2019, Wales was the first parliament in the world to announce a climate emergency. At that time, NHS Wales produced over 1 million tonnes of CO2 equivalent every year, the highest in the public sector. Our climate in Wales is already changing. This affects us all and can negatively impact on patient and population health and well-being. It can also make it difficult to deliver primary and community healthcare services. We can all help by acting now. To do this, we need to work together to collectively reach the Net Zero Wales ambition. We're inviting teams from across general practices, community pharmacies, primary care dental surgeries, and optometry practices to join others who are already taking action to reduce their carbon footprint by registering with the Greener Primary Care Wales Framework and Award Scheme. The framework contains a variety of actions to choose from to suit your interests and is tailored to your practice's circumstances. Suggestions and resources on how to start combating climate change are provided. Getting involved is easy. It's free, available online, and open to all members of staff. Just register as a team, select which actions you want to work towards, and upload evidence to prove that you've completed them. This evidence will then be used to recognise your achievements with an award. You and your team may even be thinking about or doing some of these actions already as part of your personal, professional, and organisational duties. In taking part, you'll be leading the way for your profession, making small but significant changes to create a larger, cumulative effect. Visit Greener Primary Care Wales to find out more and register using the registration code 44247. The Greener Primary Care Wales Framework and Award Scheme, helping you to take action to reduce the harmful effects of climate change in Wales.
So hi everybody, I'm Sian and I'm just going to spend a few minutes just briefly talking to you about the scheme itself and some of the achievements. So this slide has a lot of information on it, but really I just want to draw your attention to the fact that we've had over 500 practices over the last 3 years that's registered and working with us. We've given over 160 awards. There's been 4,200 or so actions. We've saved loads and loads of carbon dioxide, and we worked out what the equivalent to that is in miles in a petrol car and climate deaths avoided. And there's a little bit of a focus around the fact that quite a few of the actions are associated with inhalers. So these are our wonderful teams, lots of pictures, lots of happy faces, lots of people working together, clinical and non-clinical staff. Behind every one of these pictures is a lovely story around some of the work that they've been doing. Many are case studies written up on our web pages, but I just needed to share this and say, you know, these are the people who are doing the hard work, so well done. So when we're talking about medicines, I think it's important to understand why that we're of interest to medicines. So a carbon footprint that was done in 2018 identified that drugs and pharmaceuticals make up nearly a quarter of NHS hospital admissions. The exercise was only done in hospitals, and actually 35% of procurement emissions at the time for drugs and pharmaceuticals. So big part to play. Some medicines have a greater impact, which is why there has been a focus of inhalers over recent years. But when we're talking about medicines, it's not just the choice of product, it's how we use it. So I'm particularly interested in how inappropriate and excessive prescribing contributes to this agenda, waste, but poor medicines management and disease and symptom control, because people are iller, they then access services, they take more medicines, and they sometimes end up in hospitals that then have a huge carbon footprint associated with it. So for that reason, our framework does actually contain quite a number of actions related to pharmaceuticals, either directly or indirectly, and we've got some listed here. And we've been heavily involved in establishing a task and finish group to look at particularly inhalers, which has resulted in a strategy. And we've got new web pages, which are coming soon, where you can see all the work that's been done. And we're working with shared services around the clinical waste disposal contract and how to include inhalers in that. And then also we're working across the nations around some of those big ticket items that we're all struggling with. So take home messages. Hopefully you're inspired to go away and do something. If you're in primary care, this is how you can access our website and join our scheme. If you're in secondary care, there's lots of opportunities there, and we've listed some for you. Involve your colleagues. This is very much a team sport. The practices that have got most out of it is when they've done it as a team, and actually their clinical and non-clinical staff really play a fantastic role in it. Go away and have a look at the actions. We've got a list on our webpage. I think you'll be surprised about what you're already doing, and actually you probably already have enough to start the foundations to get some of the awards. And then maybe there'll be some actions that you haven't thought of that you might want to consider for the next 12 months or so. These are all the wonderful people that have supported us and have worked with us and helped shape the scheme to date. There are more, and the tree is growing. So if you are not on the tree and you want to be on the tree, then please contact us and we will be very happy to work with you on this. So it just leaves me to say, if there's any further information that you require, I would suggest you go to our web pages, because there's lots and lots of resources and information there, but also you can contact us directly at greenerprimarycare@wales.nhs.uk and we respond. We manage the inbox on a daily basis. And it just leaves me to say thank you very much on behalf of myself and Harriet for listening, and hopefully you've gone away a little bit more informed and a bit keen to get involved. Thank you very much.